Hello, my name is Sarah. I'm a registered nurse here in Australia, and I just want to share with you quickly my journey with my skincare and how that's been greatly assisted through this great company called Clearly Basics. With my own skin, I used to have really bad acne where it would track down like it was contouring on my face, up my forehead, a lot of it on my chin and on my nose. And I would use multiple products, go to different salons and places to get treatments done, or do homemade kits. Nothing seemed to work. And I started to stop and think, why do I, for my patients, want to understand 100% of their conditions and make sure they understand, as well as their treatments, yet I don't do that for myself? That's when I started doing some research. I wanted to understand, what is a pimple, what is cystic acne, what are blackheads, why do we get oily skin, why do we get dry skin, and then what is the treatment for that? So as a registered nurse, it is one of our biggest roles to be advocates for patients, which means we need to constantly make sure that our patients are safe and comfortable, they understand their condition and the treatment that they're receiving. When I started going through that process, that's when I then found Clearly Basics. So I had an understanding of my skin's condition, and then I found a treatment, and I wanted to research and understand that treatment, and it blew me away. And I thought, I've tried so many things, the worst thing I could do is try one more thing, and it might work or it might not, and that's fine. Nothing else has changed for me. I just continue on the same skin that I have, or I would have the possibility of having improved skin. And I wanted to take that risk because personally for me, I've had so many patients that have been on medications for their skin, and the side effects are horrendous, and I personally didn't want to have to go through that. I wanted to try every means possible and avoid that, but I was getting to the point where I was starting to think maybe I'm going to have to take the medication myself, or accept the fact that I'm going to be unhappy for most of my life with the skin that I have. So we need to really understand our condition first before we treat it. So what is a pimple? Let's start with that. That's the most common thing. So pimples are an overproduction of oil and a buildup of bacteria in our pores, and it usually happens in an area where we've got really high functioning oil glands, and that usually is on our face, our neck, our chest and our shoulders. So it's most commonly where people get this kind of effect. Cystic acne. I remember always having cystic acne where reminds me of like an iceberg. You'd see this mound, but when you feel it, there's a lot more underneath it than you can actually see. And clinically speaking, what cystic acne is pretty much a really severe type of acne where the pores become blocked and it leads to an infection and inflammation. So that's when you get like this really hard bulging, you get redness, it's quite hot, and it forms a lot of pressure. Oily skin and dry skin. Everybody has this, whether you are oily, you are dry, or combination of skin. And there's a couple of factors that fall into this. So if you're feeling really anxious or have a lot of stress, your body is going to register this. And through this, your body then releases more cortisol, which is a stress hormone, and it causes your skin to overproduce oil. And then people can get really oily skin. Blackheads, that's the most common thing that people get, and there's a lot of misunderstanding what a blackhead really is. So blackhead is actually oil plugged into a hair follicle, and when it's exposed to oxygen, that's when it turns into that dark color. People assume that it's dirt because of its dark appearance, and that we get a confusion that it's a lack of cleanliness, but it's not actually. It's just when the dead skin and the oil then reacts when the pore opens with oxygen, it then darkens in color. Hormone levels are a really big thing, and that's both in males and females, of testosterone levels, estrogen, progesterone. All these levels go up and down constantly every day and through our cycles. Depending on our age group as well, what's happening around us. Our skin is really sensitive to our environment and what's happening on the inside. So it's really important that when we notice these things, it's a reaction to something on the inside, whether that's our stress, how much we're eating and drinking properly, and the things that we're exposed to, like really high levels of air-conditioned spaces, really heated environments where you sweat a lot. It's impacted by a lot of things, and it's not just one thing that will affect it, and for each person it's different. Hydration is a big thing, so if we're not intaking proper amounts of water, or our skin is not receiving adequate amount of water and hydration, it's going to be quite dry. So a lot of people then have that really dry scaly effect. They try and put makeup on, it won't go anywhere. Some people can then progress to a certain point where their skin is so dry that their body, trying to compensate for it, will overproduce oils, but then you end up with too oily skin or combination. So now that we have an understanding of what our condition is with our skin, whether we get really bad acne, cystic acne, blackheads, if we have oily skin, combination skin, dry skin, whatever it may be, we now have an understanding of what is going on with our body. So now we can have an understanding of what we want to use and what we're going to try and do to treat it. So one of the Clearly Basics products is called the Clear Out. So this is mainly to get rid of blemishes, and has two really main ingredients, retinol and azelaic acid. With that acid component in the Clear Out, it's really good as a use of sort of like an exfoliant, but not as harsh as actually physically scrubbing the face. It's more like a chemical exfoliation. It also, with that type of acid as well, is really good as an antibacterial, which is perfect for that acne fighting that we were speaking about before, those cystic acne, those pimples. There's a lot of infection and inflammation going on in the skin, and we want to try and combat that. So your skin constantly is turning over new skin cells over and over, and it grows from the base up. And with the retinol in the Clear Out, it promotes that resurfacing of new skin and that turnover of dead skin at a more rapid rate. So then you're preventing dead skin cells essentially from clogging your pores. So I apply the Clear Out every evening to start with, because I had so much on my face. I'd do a good pump, probably about a pea size, and I'd go all over my face, because you mainly need to get it on the affected areas, and let's be honest, my affected areas were everywhere. It started to reduce, and now it is more like a spot treatment. So another product that I use in the trio is called Lighten Up, and it has two main ingredients as well, calendula and chamomile. So calendula, some people might know, but it's really good for antioxidants, which is good at protecting and soothing the skin, which we want when we were saying about before, at that turnover, that skin rate, and we also want to help with that inflammation, that infection. So we want to soothe and put in as many antioxidants as we can. With the chamomile, it has a really good anti-inflammatory process to it as well as a component of antioxidants as well, which is really good for reducing like the redness and the blemishes, which are really good for that outward appearance. But in terms of your acne as well, if that's your biggest concern, again, we want to fight that infection and that inflammation process that's happening with our skin. So Lighten Up is really good for that. I apply this morning and evening, just a tiny little pump, and I pop them in the main areas that are affected. The third part of the trio is the protective moisturizer. Now remember, we were saying about with our acne, a lot of it is to do with that dry, dead skin and that over oil production that's clogging our pores. So how are we going to do that? We want to put accurate amount of moisture and hydration to our skin, so we don't get those dry skins appearing on the surface and then clogging the pores, or that we get that overproduction of oil and then the bacteria, so then we're clogging the pores, and that's when we get our pimples and our blackheads and our cystic acne. So proper hydration. So we want to use, there's this chemical called, excuse my pronunciation, resveratrol. Pretty much it's a similar thing that you find in wine, which is in really good harvested grapes. So it's full of antioxidants, which again, that's just really important for our skin. It's also found in other things like peanuts and berries and dark chocolate. So again, quite natural, and it's fantastic for anti-inflammatory. The next part of peptides. So peptides, they're important for amino acids, and amino acids are a type of protein, and they're part of the building blocks of our body. Everybody's skin is different, and everybody's skincare journey is different. I got to a point where I felt like I was giving up. But if you're going to take one thing from this video, please just give Clearly Basics a try. If you've learned things about your skin and about different ways of treating it, that's fantastic, but I'd really recommend that you give it a go, because you will be so thankful.